Which of the following diagnoses best fits this patient's presentation? We have obsessive compulsive disorder, obsessive compulsive personality disorder, generalized anxiety disorder, autism spectrum disorder, and narcissistic personality disorder. We've got a 35-year-old man who's referred to a psychiatrist by his primary care physician due to concerns about his interpersonal relationships. The patient has a long-standing pattern of excessive perfectionism, inflexibility, and preoccupation with orderliness, which has led to difficulties in his personal and professional life. He is highly detail oriented and often spends excessive amounts of time on tasks to ensure that they are completed perfectly, causing him to miss deadlines. He has no history of intrusive thoughts or compulsive behaviors, and his medical history is unremarkable. Um, I'm gonna break down why the last 3 are wrong because I know it's some sort of obsessive compulsive, so he doesn't meet any of the categories for generalized anxiety disorder. Autism spectrum disorder would have to present during early development, and then narcissistic personality disorder doesn't fit because he's not showing any signs of, like, heightened sense of self. Um, I know there's like fancy official words that go with it, but the way I remember obsessive compulsive disorder versus obsessive compulsive personality disorder is that obsessive compulsive disorder has like the compulsions that are like anti your goal, whereas like with personality disorder, they at least go towards your goal, or like they're what when we call someone OCD, it's really the personality disorder, which is what fits in this question. So I'm gonna go with B.
Final answer.
Yeah.
Great, great, yeah. So, it's the personality disorder, right? Consistent with kind of how he is, right? But OCD, right? Intrusive thoughts, right? With obsessions and compulsions that individually driven to perform, right? In this case, does not have a history of intrusive thoughts or compulsive behavior. It's just his personality, right? So, yeah, I think that's one of the key things that I'm glad that you got it between these two and they were able to pick the right one. So, just a little bit, you can just veer a little bit one way and probably get the wrong answer. So definitely, I think you got kind of the details.